Have you ever wondered what the most important nutrient for immunity is? Hi, Luke here, dietitian from Active Health Clinic. And while the true answer to that question is probably more complex than just one individual nutrient, today's topic is a pretty important one when it comes to immunity and living with invisible illness. Pardon me. Vitamin D is one of the most commonly found nutrient deficiencies, especially within the invisible illness population. And that's an issue because vitamin D plays a key role in energy and immunity, as I mentioned, as well as bone health, mood, and heart health. The trouble is that the main way to get vitamin D is from the sun, and being out in the sun is difficult for many with invisible illnesses for a variety of reasons. So sure, foods like cod liver oil, salmon, and tuna have plenty, but not everyone likes or can eat fish. And similar products that are fortified with vitamin D, like orange juice and certain dairy products and other foods like mushrooms and egg yolk and beef liver, they all contain this vitamin D, but not as much vitamin D as probably what we need on a daily basis. Although, fun fact, you can suntan mushrooms for 20 or 30 minutes before you eat them, and that'll give them a little bit more vitamin D content. Even with all of those foods in your diet, which isn't going to happen for most people, it's still recommended that you get some sun exposure to get your vitamin D intake for the day. When we can't do that, or when we've already got low vitamin D levels, or when you live in a place like Melbourne and it's winter and you don't actually get that sun exposure a whole lot, well, it's worth actually thinking about getting your vitamin D levels checked, and if they are below a certain marker, actually starting to supplement them. Now, some labs will say 50 to 250 is normal, but I like to get people going a little bit higher than that low marker of 50, somewhere about 80, and that seems to be a pretty good place to sit. So if you are severely deficient, you might need to take lots more than what's recommended on a bottle of vitamin D. If you're sort of mildly deficient or sitting around that 50 to 80 mark, 1 or 2 or maybe 3,000 IU a day might be sufficient for you. But of course, go and get this all checked out with your doctor and your pharmacist. This video is more to bring your attention to the fact that vitamin D can be something that you have control over to take, that can significantly impact your immunity and your energy levels, which are two things that we want all the help we can get with from an invisible illness perspective. So if you found today's video helpful, let me know in the comments what other nutrients you might like some information on, and who knows, you may just get a video on it. But for now, take care and happy eating.